Traditional PBMs are a real pain for doctors who simply want to deliver the best care possible for their patients. Today, I'm going to open up the black box in which traditional PBMs operate. I'm Dr. Eric Bricker, and I'm also a healthcare finance expert. I know how doctors get taken advantage of financially, and that's why I've partnered with Know Health to share with you what I know. This is Healthcare Uncovered. Traditional pharmacy benefit managers, more commonly known simply as PBMs, are the departments within big health insurance companies that control whether or not a medication will be paid for. The big three in this space are CVS Caremark, Express Scripts, and Optum Rx. Here's how the process works, or at least should work, or actually doesn't work. First, the doctor must determine if a medication needs prior authorization. Second, the doctor must submit the prioritization either by fax or an online submission form. Third, the prior authorization tech at the PBM needs to enter the information from the fax into their own prior authorization system. I'm not making this up. Then, a pharmacist at the PBM reviews the prior authorization request. If the request is approved, the medication can be filled and the pharmacy will be paid. If the request is denied, the reason for the denial is sent back to the doctor. If the doctor disagrees with the denial, which is usually the case, the request can be escalated to a medical director at the PBM. Then all bets are off. But assuming things go fine, even then, the prior authorizations can take 1 to 3 business days, which can delay patient care and potentially harm patients. In fact, 25% of doctors say prior authorizations have caused adverse health events in their patients. And 16% say that delays due to medication prior authorization have resulted in unnecessary patient hospitalizations. Yes, PBMs are making people fare worse, not better. But why do these medication prior authorizations exist in the first place? When health insurance companies contract with employers and governments, they tell them that they will decrease overprescribing by requiring prior authorization for certain medications. And employers and governments believe them. That's right, the ultimate payers for healthcare in America are employers and governments, federal, state, and local. And these payers think doctors prescribe too many medications. Here's the thing though, are payers wrong to think doctors overprescribe? 40% of older Americans take 5 or more prescription medications per day, which is a 300% increase in the last 20 years. Unfortunately, with more medications comes more adverse events. There are now over 250,000 hospitalizations every year for older Americans just because of an adverse drug event. So prior authorizations delay care and hurt patients, but too many prescriptions hurts patients too. What to do? Some states are putting in so-called gold card programs where if a doctor has been found to have his or her prior authorization request consistently approved, they no longer are required to obtain prior authorizations in the future. These gold card programs don't solve all the problems, but they are a start. I'm Dr. Eric Bricker, and this is Healthcare Uncovered, where we break down a broken system.